Professional teeth grinding, also known as bruxism, is typically addressed by dental professionals, such as dentists or orthodontists. Here are some common methods they may employ. Custom mouthguards or splints. A dental professional can create a custom-fitted mouthguard or splint designed to fit your teeth precisely. These devices are typically made from a hard acrylic material and are worn during sleep to prevent grinding and clenching. Orthodontic treatment. In some cases, misaligned teeth or bite issues can contribute to teeth grinding. Orthodontic treatment, such as braces or aligners, may be recommended to correct these issues and alleviate bruxism. Medication. In certain situations, a dentist or physician may prescribe muscle relaxants or other medications to help relax the jaw muscles and reduce grinding. Stress management techniques. Bruxism is often linked to stress and anxiety. Dental professionals may recommend stress reduction techniques such as relaxation exercises, meditation, or therapy to help manage stress levels and decrease teeth grinding. Behavioral therapy, cognitive behavioral therapy, CBT, or other behavioral therapies may be recommended to address underlying psychological factors contributing to bruxism. It's important to consult with a dental professional if you suspect you are grinding your teeth. They can assess your specific situation and recommend the most appropriate treatment plan for you. Left untreated, bruxism can lead to serious dental problems such as tooth damage, jaw pain, and headaches. Thank you for watching. Don't forget to follow the channel and recommend it to your friends. Stay informed.